I am going to show you how to edit and manage the dental reports. So dental reports means nothing. You need to edit a report to the patient with the diagnosis, or you need to edit a report to the insurance, including the report and the treatment plan, or you need to edit a report for your dentist referrer for something that you've been doing for them, or you can edit a report for a treatment plan. So whatever kind of reports, the first thing you need to do is to go to the claim form. So you go to the claim form, you go to the report, the utilities, layout, and you have the claims first, and you're going to look for report. You should have something which is called report. I have this, and I made it for me. So if you want to make it for you, you can update dental report. You can update this. You have the date, you have the patient's name, you have the content. This is called diagnosis content. What is a content? You will find the contents here on the right side, and you have content for invoice discount content, quotation content, diagnosis content, whatever content you want, you have all here. And when you click on that side on the right side, it will implement the discount, the diagnosis exactly at the same place. Quotation discount content here. The teeth, so you will be able to add a text on special teeth. No need to write everything. You will just add the number of the teeth, add the number of the teeth for root canal issues, or perio issues, or decays, and all that. So this must be prepared for your reports. You can have several kinds of reports if you want. You select what you want, but you need to have a report. Then you go to the patient's file, and you are going to go to treatment plan. This treatment plan will be like a test, so I'm going to show you what we do. We go to semiology, which is a diagnosis. You make a diagnosis. You have a series of diagnoses which are here, but you have a lot more if you want to implement more. In my case, I will use MO dental decay on the dentine on this tooth. So I have a decay on the upper left side incisor, and I am going to do a filling on this tooth, which is a mesio-occlusal filling on this tooth. So now you've been able to edit two lines, one line for diagnosis, one line for the treatment. I am going to select both, or before selecting both, I am going to go to message. And I'm going to edit a message. A text message will be added into a text. The upper left incisor must be treated in emergency. So you see, I have been recording that. The upper left incisor, so there is a little mistake, I correct. Incisor. Incisor must be treated in emergency. That's it. So I'm going to save this. And when it is saved, I can copy the text, but this text can be a text with comments on the way we've been doing a procedure. Can be something for the patients to know what we need to start with. It can be something that we send to a referrer. So I copy the text, it is copied, and then I go here, I can refresh, and you will see that the message is being changed from blue, where there is no message, to green, where there is a message. So now I select both. I am going to go to forms. I am going to look for the report, and this will edit the report. So now we have the logo, we have the address, we have the title, we have the name of the patient, and what we have the diagnosis. So this is the diagnosis. If we want to remove one line, we can remove one line. But what we can do also, we can add an OPG if we want. So you can go here, add OPG, and you can add OPG or a clinical image if you want. And then you have the procedure. And then you can add manually what you want. Maybe there is a decay on 21. There is an apical infection on 11. okay, chronic apical infection. In perio, you have an acute gingivitis or something like this. You can remove that that you don't want to use, or you can customize that. So now you've been able to add the diagnosis from the semiology. You've been able to add the treatment plan from the treatment plan, and you've been able to add the pictures from the list of pictures that you have, and now you can send that to the patient. So instead of printing things and giving in paper, we work paperless now, so we can go digital. All this is digital, and we can save and send that to the patient in digital. And when the email is sent with all details, I go to my emails and I can open the file of the emails, and I see the files which has been sent to the patient with the dental report and all that. And it's very easy for the patient to forward to the insurance or to receive and read it on his side. I thank you for your attention.